Hello, this is Dr. Susan Marra with Dr. Marra's Medical Minutes. And have you ever wondered what lupus is? Lots and lots of people have lupus. Lupus is an autoimmune disease that is characterized by a butterfly rash across the nose and across the cheeks. And it can also involve muscle and joint pain, a fever higher than 100, rashes more than the classic butterfly rash, chest pain, hair loss, sun and light sensitivity, kidney problems, and mouth sores. So, why do I want to talk about this? Because lupus is an autoimmune disease. And what do we know about autoimmune diseases? A lot of times, what is underlying autoimmune diseases is infection, tick-borne infection, Lyme disease, Bartonella, Babesia, Ehrlichia, Anaplasma, Rocky Mountain spotted fever, Tularemia, on and on and on. So I would encourage anybody with a diagnosis of lupus to wait and hold off on the biological medications that typically that the allopath would prescribe to you, and get yourself tested for tick-borne illness, because if it is from infection, it's more easily treated with antibiotics than it is with biologics. Okay, biologics have lots and lots of side effects. And not that antibiotics don't. You have to obviously take care of your microbiome. But I mean, I have seen lupus become eradicated with uh, antibiotics for tick-borne illness. Several of my patients have had Lyme and Bartonella, and they have a diagnosis of lupus, but it's not really that. It's from the infections. These infections are intracellular infections. And when they do get into the intracellular compartment, it really becomes a problem, because they have epigenetic consequences. They disrupt autophagy. They disrupt other cell organelles like the mitochondria, the lysosomes, the ribosomes. When they get into the intracellular compartment, they wreak havoc. They also damage the outer cell membrane, which is a lipid bilayer, and then you have to have cellular repair. So, take home message: if you have a diagnosis of lupus, you are going to want to see a Lyme literate doctor who will do the correct tests in order to figure out if your autoimmune disease is due to an intracellular infection like Lyme, Bartonella, Mycoplasma, etc. If it is, then you probably shouldn't go on biologics, because they are immunosuppressive and they will not help you if the etiology of the problem is infectious. So I hope this information has helped you, and I hope you have a wonderful day.